Welcome to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, a doctorate prepared nurse practitioner, and this show is about empowering you to live a radiant, healthy, and balanced life. I'm very excited to introduce today's guest, Dr. Angelo Ippolito. Dr. Angelo is the owner of Palm Coast Health Chiropractic and brings over 30 years of experience in chiropractic care, providing patients with an effective alternative to injections, surgery, and medications in order to resolve pain. Dr. Angelo completed his undergraduate studies at Yale University with a degree in molecular biophysics and biochemistry. He continued on to New York Chiropractic College, where he received his doctorate of chiropractic, graduating magna cum laude. Thank you so much for being here today.
Thank you, Dr. Amy. I didn't realize I did all that.
That's amazing.
Wow. It's nice to hear. Yeah, it was a long journey, but here I am in the new hub of the universe, Palm Coast, doing as you are, trying to bring health and revitalization to the citizens here.
Yes, and we're exploring knowledge. So today we're going to talk about myokines.
Are you talking about the magical muscle molecules?
I believe I am.
Well, yeah, and thank you for, we went over a few topics, and you gave the okay on this one, which I think it's almost too good to be true for people like us who want to educate people that this subject exists. It's untapped. It's there for us to just bring it to the people. And it is such a vital component of overall health. And I will tell you that I do a lot of public speaking. And every single time I start, I ask for a show of hands. Who knows what a myokine is? I have not seen a hand go up yet. So this is important.
Yes. Well, let's tell our listeners, what is a myokine?
Myokines are, it's a fancy way to say a molecule. It's a protein. It's a signaling protein. So we don't want to go too deep into the biochemistry. What's important is that it is made and secreted by skeletal muscle. So that's where the myo comes. So we have, for so many years, decades, known that muscle is responsible for movement, strength, athletic performance. But as of 2003, when the first myokine was discovered by a Dr. Peterson, it changed the complexion of how we view muscle. And muscle now is and should be viewed as an organ, an endocrine organ of longevity. So it's not just moving us. Muscles are making these myokines that talk to all the rest of the body. And you and I both know, growing up, how many times have we heard exercise is vital for health?
Right.
And it wasn't really until the discovery of myokines that we could put a reason to that. So up to that point of the myokine discovery, it was correlative. People that exercised were healthier. And there wasn't any other information to kind of give context to that. Now we know that when you exercise, and we'll talk about, because there is a way to do exercise, there is a way to generate these myokines when you contract your muscles. But now we know, when we go over the span of systems that myokines govern, that's the reason why exercise is going to improve overall health.
That's so fascinating. So you mentioned myokines are messengers. Who are they talking to? Or what?
All right, so let's take a step back and let's just think about you're contracting your muscles.
Okay.
And we'll go into that a little later as far as what's required for that. But you're exercising. And now, with every muscle contraction, the myokine comes out of the muscle.
Okay.
And it can work in one of three ways. The clinical terms here are autocrine, paracrine, and endocrine. So let's simplify that. Autocrine means if the muscle makes a myokine, that myokine is going to stay inside that muscle and do some magic. If it's paracrine, it's going to come outside the muscle and hang out there and affect nearby tissue. The most fascinating way that this happens, though, is that the myokine gets into the bloodstream, and now it goes and can reach all different organs, like the brain, like bone, like liver, like pancreas, and get those tissues to do things that are going to support overall health.
Right. So you mentioned a myokine can go to the brain. And why is that beneficial for the brain?
Well, there are approximately 600. This is look, 2003, right? So what? Not 22 years. This is relatively new on the scene. So this is probably why this information isn't mainstream yet.
Not yet.
But thanks to shows like this, it's going to be. But there's about 600 of these myokines that have been identified. And out of the 600, there's probably a dozen that have been studied really closely. One of the myokines that has been studied in depth is something called BDNF, and that stands for brain-derived neurotrophic factor. Now, the brain makes that. Hence the name. It's brain-derived. But the muscle can also make its version of BDNF, which is muscle-derived, brain-derived neurotrophic factor. That's why it's quite a mouthful. But what happens is when you do proper exercise, BDNF will leave the muscle and it'll go. Interesting thing about BDNF is it can cross the blood-brain barrier. So now it's in the brain and it will have an effect on neurons. Here's what it does. It might be not in the scope of this talk, but you and I, we always try to teach people that things are always happening on a cellular level. So now you have this molecule in the brain, and it's going to go into a cell. And in this case, it's going to affect neurons. And BDNF is going to help neurons connect with each other. It's called synaptogenesis. It's going to, if you remember your neuron anatomy.
So long ago.
Yeah. So you had the axon and you had dendrites, and the dendrites were these branches that would connect. BDNF encourages dendritic growth. So all these things create what is called neuroplasticity. So that's where, and if you look at the research, people that are low in BDNF, here's what they look like clinically. Depressed, more likely to have Alzheimer's, more likely to have Parkinson's, more likely to have any of the neurodegenerative cognitive disorders that we know about. So that's what BDNF does.
So when we say now that exercise helps prevent Alzheimer's and it helps cure depression, is it because the exercise is releasing the myokines, or specifically the BDNF, that increases neuroplasticity?
I wouldn't say it's just there's a absolute causation there, but it's going to contribute. It's one of the myokines that's going to. So let's use that example. We're talking about exercise, and it's going to prevent Alzheimer's. Well, BDNF is one of the myokines that's going to do that. Now, there are other myokines that are also going to get into the brain and are going to decrease inflammation. Alzheimer's, like all these other chronic degenerative disorders, are inflammatory. So there's a myokine called interleukin-6, and that one, again, goes into the brain, gets into the cells, and basically once it gets past the cell membrane, and this it's a complex topic, which is signaling proteins. But once this thing gets into the cell, it kickstarts a cascade of events, and ultimately, a lot of times, it'll wind up in the nucleus, causing the upregulation of a gene. And now that gene is going to make a protein that's going to be helpful. So that's kind of how these things work. But that's another way that a myokine could prevent Alzheimer's disease.
Right. And so most chronic diseases, most people can agree now that inflammation is a component, whether it's cancer, Alzheimer's, like we mentioned, and even pain. So if we can do things to decrease inflammation, we're going to be healthier overall.
Oh, yeah. Myokines also, so again, we talk about crosstalk. So that was crosstalk between the muscle and the brain. Mm-hmm. The muscle also talks to the immune system. The immune cells, of which there are many, they make cytokines, which is another kind of protein, that are either inflammatory, pro-inflammatory, or anti-inflammatory. You want a balance. A lot of people don't understand sometimes that it can't be too much immunity. That's an autoimmune disorder. Right. So you don't want too little immunity. That's with cancer and AIDS. That's not good. But too much immunity, that's a very pro-inflammatory situation. If you recall during COVID, do you remember the term cytokine storm?
Yes.
Well, cytokine storm is when there's too much of a response from your immune system. So that clearly indicates an imbalance. By the way, the number one thing that balances those two things out is vitamin D. We could talk about that.
Very important.
Another time. But so inflammation is widespread in the genesis of all these chronic diseases. And myokines have a way, some of them, will get into the cell, if it's an immune cell, and turn off the production of... So imagine now this myokine is in an immune cell, and the immune cell's job is to make cytokines. The myokine will instruct the immune cell to make less pro-inflammatory cytokines and more anti-inflammatory, like interleukin 10, for example. That's a very strong anti-inflammatory cytokine.
So when we talk about immune cells, you mentioned autoimmune disease, and something we deal with a lot in my practice, and probably yours as well, is Hashimoto's. Thyroiditis. And so, and for our listeners, autoimmune disease means the body's attacking itself. So that's what we mean when we're saying that. So would releasing more myokines help, or myokines, excuse me, would that help with certain autoimmune disorders?
Only in the sense of balancing the immune system.
Okay.
I mean, we could go off on a tangent here with Hashimoto's. We could talk about how, I'm sure you know this, most autoimmune disease starts in the gut. So
gut health, yes.
Things aren't right in the gut. And I don't like the term, but patients understand it, leaky gut.
Right.
So the integrity of the small intestine, it needs to be permeable, but it shouldn't be so porous that it's letting things into the system that shouldn't be there. Most people don't know that what's ever inside your gut is technically outside your body. It's like physically inside, but that stuff is not in your circulation.
Right. So that's our waste and things that need to exit the body.
Exactly.
And it should not enter the circulation because that can cause inflammation.
So when the intestinal lining is a little too porous, it's designed to let food molecules in, the macronutrients, amino acids, carbohydrate, saccharides, fatty acids. What shouldn't go through are big, giant proteins. And then there's also bacterial waste, lipopolysaccharide. These things should remain inside the gut. When they get out, here's what happens. If a big protein is allowed to get through into the circulation, your immune system is going to say, That doesn't belong.
Right.
And it's looking at it. It's surveilling it. It's fast. It's called molecular mimicry. And what's going to happen at some point is that protein sequence of amino acids that keeps coming in, maybe it's gluten or
Right.
the gliadin molecule. Sooner or later, your body's going to say, you look like something in my body. You look like my thyroid. You look like my pancreas. You look like my joints. And that would be Hashimoto's thyroiditis.
Right.
That would be diabetes, type 2 diabetes. That would be rheumatoid arthritis, respectively. So, yeah.
So we don't want that.
No, we don't.
No. I'm going to have you hold that thought.
Okay.
We're going to pause for a break from our sponsor. You're listening to Energize and Revitalize with Dr. Amy. Don't go anywhere. We'll be right back. Welcome back to Energize and Revitalize with Dr. Amy. I'm Dr. Amy Coopersmith, and my guest today is Dr. Angelo Ippolito. Before the break, we were talking about myokines. And just to review for our listeners, myokines are substances secreted by the muscle that tell different organs to do different things. In order to secrete myokines, we need to contract our muscle. So what is the best way for a person to do this to release myokines?
So a great question, and it's important to know this because movement in general is medicine, all kinds of movement. But if we're looking to get the myokine released, then we have to do, I call it a purposeful, meaningful contraction. So things like weightlifting, resistance training, high intensity interval training. Basically, you're putting that muscle through a series of contractions, generating a stimulus strong enough to tell that muscle to change. And by the way, this is my definition of exercise.
Okay.
It is movement that will create a metabolic adaptation. So something that you're doing to your muscle where after the exercise event is over, that muscle's going to say, if he does this again, I'd better be stronger,
Right.
I'd better be faster, or I'd better have more endurance. Those are the three metrics. And if you're doing something with your muscles that is going to improve one or all three of those metrics, as far as I'm concerned, that's exercise. That's the type of exercise that is going to get you your myokine. Now, if you go deep into the research, which I have, sometimes a particular myokine is best elicited with resistance training.
Okay.
Other times, it's best elicited with long duration aerobic training. So
How do we know?
read the book.
Read the book. How do we know when to do endurance training and when should we do weights?
Well, this is where you get somebody that really can design a training program. So the first step, of course, is to not sit.
Okay.
So we've established that. Now you're up. So planned exercise, and again, everybody's goal is different. What do you want exercise for general health? Do you want exercise to burn fat? Are you an athlete? Are you trying to increase performance? And those nuances, I know a little about it, but I'd feel comfortable working with a trainer that really understood what you and I are talking about right now. But overall, a good weekly strategy for exercise would be a good amount of resistance training. You can't get around that. And I will tell you, as you talk to your patients, I talk to my patients, this is what is usually missing.
Right.
So the patient will say, I walk on the beach. Okay, that's nice.
Walking's good.
Yeah, I stretch. That's a big one.
Okay.
I stretch. Yoga is very nice. Isometric contraction. We'll talk about different contractions. But then I say, there's no evidence of you doing anything to your muscle to keep it. You're not stimulating. You're not challenging your muscle with a stimulation strong enough to build more of that muscle. And resistance training does that. Doesn't have to be weights. Can be body weight. Could be resistance bands. but that's resistance training. And so you need some of that if you're designing this weekly exercise program. You also need something that's going to train the aerobic system. So resistance training is anaerobic. You want aerobic training. And there's a couple of different flavors there. You want maybe 1 or 2 days of some of the long duration, which I can't stand, but you're on a bike and you're going to pedal for 30, 40, 50 minutes. It's not going to seem too challenging, but believe it or not, that establishes your baseline aerobic capacity. Then, once that's been established, now, every now and then, you throw in some interval training, which is almost like a cross between both, because you're using, and we'll talk about muscle fiber types in a second, you're using the muscle fiber types that you would use in resistance training while you're doing the high intensity. So when you cycle like a maniac, that is not fat burning, slow twitch, slow and steady. But you need to introduce that, and now you have all three: resistance training, long and steady, which is called zone 2,
Okay.
and the high interval training. My opinion, that is a great mix.
I agree. I think changing it up and not doing the same thing all the time.
Yeah, sure.
Because our bodies just get used to what we're doing.
Yep.
And you mentioned zone 2. So that's more of you're working, your heart rate's elevated slightly.
Yeah. This is your listeners will find this very helpful. So I see people in the gym and they're using the heart monitor on the bike, which you just can't imagine how inefficient that is. They have heart monitors. They're looking at their watch. Yeah. Okay. Believe it or not, and this is evidence-based, they've studied this, there's something called relative perceived exertion, right. RPE. Now, there's a little bit of a learning curve here because you have to learn it for yourself. But very simply, if you're doing an activity on a scale of 1 to 10, where 10 is you're running for your life.
Right.
If you don't run this fast, you're going to die.
Yep.
That's a 10. I think people rarely get there. But 9 is achievable. So when you do high intensity interval training, you're 9. But not for a long time, you'll collapse.
Right.
Zone 2, take it down to a 6. And now you're doing the 6 perceived intensity for 30 minutes, for 40 minutes. I read something once, and it kind of makes sense. You're in zone, and zone 2 is not just taking a walk, because you could be on the bike and hitting a 2 out of 10. You're not getting anything out of that.
Right.
Maybe some range of motion. But zone 2, it's still challenging, but I remember reading something about you're still able to have a conversation with somebody. Once you can't have the conversation, now it's a 7, 8, or 9.
Right.
And you're using what are called the type 1 slow twitch fibers that use fat for fuel. So you need a baseline of that. You need to let the body know that this is something that you can do, because this will actually help you burn fat at rest, which is the key to fat burning.
Absolutely. And I think it varies by activity too, that perceived level of exertion.
Yeah.
I've kind of experimented with myself and just, I would look at the heart rate after the fact. Like, I wonder, and I'd say, when I feel this way, what's my heart rate doing?
Right.
And
it correlates.
Yeah.
But a lot of times the heart rate has a lag. So you'll be doing, let's say you're on a bike and you're doing high intensity interval. And I like doing intervals, 15 seconds like a maniac.
Right.
Then 45 seconds rest, 15 seconds like a maniac. Do that 8 to 10 times. That's a great workout. So your heart rate during the 15 seconds of being a maniac is not going to go super high until 20, 30 seconds. So the heart rate can be deceiving, but not if you're using perceived exertion. You know that it's a 9 out of 10.
Right.
And you just want to stop.
But you don't, because you have to do this for your health,
of
right?
course, yes.
I like how you mentioned with the weight training. Sometimes people say, I can't afford to go to the gym or it's too much. And you can do body weight exercises,
Yes.
which is free. You can do it anywhere as long as you have the right technique.
Oh, yeah. I have something that I've created in my office. It's a very long story, but years ago I created this for an elderly woman patient who she was in her 60s and she knew that she was supposed to do resistance training.
Mm-hmm.
She was ahead of the curve. This is like 15 years ago, 20 years ago. But she said, I don't want to go to the gym. I'm afraid of people. I don't want to travel.
Mm-hmm.
I said, Elaine, I'm going to get a resistance band for you, and I'm going to cut it a certain length,
Mm-hmm.
and I'm going to create a workout for you with this resistance band. And I've taken that to a very new, whole other level that I do this myself. But to your point, I could get a workout on the beach with my resistance band. I don't have to go to the gym. So yes, you don't have to go to the gym. You can do body weight. You could do resistance bands.
Mm-hmm.
But the key there is your muscle contractions have got to be meaningful enough to generate the myokines.
Right. Now, let's say I want to know, am I generating myokines? Is there a test I can take to find out?
Unfortunately, no. That would be great. I do blood work as you do.
Right.
And I would love to just send somebody off to the lab and get a nice printout of what their myokine status is. You know, now that I'm thinking about it for the first time, it would be difficult to do because these are not the kind of things you store.
Right.
So you do the exercise, you generate them, they're in circulation for maybe a minute to an hour, and then they're gone. So I could see maybe testing somebody, like putting them on a treadmill or making them do weightlifting, and then measuring whether or not they're making myokines.
Immediately after?
Maybe, yeah. But again,
someday.
What's that going to tell us? So I would say we'll probably never see any kind of myokine panel. Mm-hmm. But the important thing to know is that we are making them when we exercise.
Right. So it's another reason that we just have to exercise.
Well, I thought about this morning, and I like, as you do, empowering people. Mm-hmm. And we've both heard, I don't have time for the exercise. There's so many excuses. Right. So my hope is that because with me and my patients, and you know this, they all want the how. Everybody wants to know how. You will not get that from me until you get the why. So I am going to force the why on you. And if you're not interested, you're not getting the how. Tough. But I'll give you the how once you get the why. And now you tell somebody who's kind of like, well, maybe I don't want to exercise. Why am I doing it? And now you say to them, hey, look, you see this myokine thing? Do you understand what they are? Do you understand that they're going to prevent cancer, that they're going to prevent diabetes, that they're going to make you less fat, that they're going to prevent Alzheimer's? That's something that a patient's going to understand. Really? Yes, really. Okay, maybe I'll join Planet Fitness or buy resistance bands. So I think that'll help people in general be more motivated to do this. We're giving them the why.
Yeah, I like that. So we're just about out of time.
Okay.
So how can our listeners learn more about you and your practice?
The best way to find out what the practice is go to Palm Coast Health, all one. PalmCoastHealth.com. We have a very nice website. You'll learn a little more about me and the services I offer. There's a way to schedule an appointment there. We're doing a lot of social media lately. So you'll find us. We're here.
Great. And we'll put a link on our page as well.
I really appreciate it, Dr. Amy.
Thank you again for joining me today.
Thanks for having me.
And thanks to our listeners for tuning in to Energize and Revitalize with Dr. Amy. If there are topics you would like to hear more about, please send an email to radiantpodcast2025@gmail.com. Check out past episodes on Amethyst Wellness YouTube, and please like and subscribe. I'll be back next Saturday morning at 7:30 with more expert insights and practical strategies to help you live your healthiest, most energized life. Until then, stay healthy, and here's to your best life.